Hai, Assalamualaikum warahmatullahi ta'ala wabarakatuh. My name is Nur Kalisa binti Muhammad Samsul Ma'arif Al-Bambani. Today I will present on my research paper, which is on withdrawal of artificial nutrition and hydration on Muslim patients from the ethical and Islamic perspective. First of all, I would like to thank you to Puan Kamilawati Muhammad because spending her time to listen to my presentations. So my supervisor is Professor Dr. Muhammad Zaharuddin Zulkifli and my metric number is 1181496. Let's get started. So basically, this is my abstract. So this research seeks to address the discussions and rulings on end-of-life decisions from Islamic context with the hope of increasing the understandings of the issues of the making decisions at the end-of-life care among medical practitioners and laymen. This also includes a situation when there exist conflicts between the religious and cultural values of the patients and routine medical practice, or when the wishes of the patient's family members are opposed to what the doctors feels would be in the best interest of the patients. The findings of this show also will demonstrate how Islam takes a holistic approach to the issue, which would assist people in dealing with the current difficulties in the issues of end-of-life care and provide assurance to Muslim doctors, in particular of the ethicality and morality. Next, we move on to the research objective. So the first of the objective of my research is to identify issues in the end of life of care on the seriously ill patient. Second is to understand the concept of this medical treatment, which is a withdrawal of artificial nutrition and hydration, ANH. And third, to identify the application of related fatwa in these matters. So the methodology that I use in this study is by referring to both primary and secondary sources. This study adopts a qualitative method of a doctrinal analysis, sources relating to medical treatment and issues at the end of life. And I'm also included a few of verses of Holy Quran, Hadith and decrees, fatwa from the leading fatwa committee and fatwa body. So we started with the question, what is ANH or artificial nutrition and hydration? So basically, artificial nutrition and hydration is a clinically assisted nutrition, which is a food for people who are seriously ill, whether it's recovering from surgery or receiving end-of-life care. It contains nutrients and fluid that is fed to the patient through a tube by mouth, stomach, or intestines and nose. It is by a PEG or RIG, as you can see here in the picture shown. Okay, all this means of providing nutrition or also provide fluids necessary to keep patients hydrated, which is the food. This patient or this terminally ill patient are receiving the foods through a tube by mouth, stomach, or intestine and nose because unable to eat food through their normals means. Providing nutrition and hydration by tube or drips may provide symptom relief or prolong or improve the quality of the patient's life. But there is a current evidence about the benefits, burdens, and the risks of these techniques as patients, especially patients at the end of life of care, is not a clear cut, and also receiving a few of risks and burdens because these patients may be experiencing distressing symptoms and complications as well as suffering. This is where the palliative care comes. Okay, what is a palliative care? Palliative care is a specialized medical care for people living with serious illnesses such as heart failure, cancer, dementia, and many more. This type of care is focused on providing relief from the symptoms and the stress of the illness. The goal is to prevent or to treat the symptoms and side effects of the disease as early as possible. It is also to improve the quality of life for both for the patients and for the family. So, what is from the Islamic view? What is about from the Islamic views? Right. So the Islamics permits palliative sedation because this is based on the Islamic legal maxims that actions are to be judged by their intention al-umuru bimaqasidiha. It follows that the intended purpose of palliative sedation is not to facilitate death. Second, palliative sedation is also based on the other juridical principle such as al-dararu yudfa'u biqadr al-imkan, which is harm is eliminated to the extent that is possible. Referring to the intolerable pain suffered by the patient, the justification for the administration of opioids drugs can be also further justified by the ruling of al-darurat tubihu al-mahzurat, which is makes the unlawful lawful, where it becomes a necessity to alleviate the intolerable pain and distress suffered by patients at the end of life. So, we move on to the next care. What is a terminal sedation? Terminal sedation is a term used to indicate the act of administering deep and continuous sedation or specific drug, which is a painkiller, while foregoing artificial nutrition and hydration from a terminally ill patient. Islam considers the provisions of food and water to be patients' basic needs in the delivery of medical care. As long as the person is alive, it is his fundamental right to be fed. Thus, Islam maintains the position that patients should not be denied their basic human rights of nutrition and hydration even at the end of life. The patient also given the right in Islam to refuse the treatment that will not benefit him or provide him with a better quality of life. The authority of this principle is based on the incident when the Prophet or Nabi Muhammad SAW became terminally ill, and there were times in which he would lose consciousness. During one such occasions, his companions, as Sahaba, tried to force feed him with medicine, according to which the Prophet ﷺ indicated his disapproval by waving his hand at them. When the Prophet ﷺ came to his senses, he approached the Sahaba and voiced his displeasure at their actions. So, what is the fatwa issued in these related matters? First, according to the Saudi Commission for Health Specialties 2014, there should be continuous care, including provision of suitable feedings of fluids for patients suffering from terminal or incurable diseases by whatever means. Second, from the Ethics Committee of the Islamic Medical Association of North America 2005, the patient should also be treated with full respect, comfort measures, and pain control. No attempt should be made to withhold nutrition and hydration. And a similar fatwa has been made by the National Fatwa Council for Islamic Religious Affairs Malaysia that if the patient no longer has any hope for recovery, withdrawal of definitive treatment is permissible. But supportive treatment, for example, hydration and nutrition, must be nevertheless be continued. Some Muslim scholars also suggest that the decision to withhold or discontinue artificial nutrition and hydration should be made by looking at the issue from the perspective of non-maleficence. If, in the opinion of the medical expert, the provision of nutrition and hydration through artificial means would be futile and further worsen the patient's condition, then it will be justified for the doctor to not administer it on the basis of la darara wa la dirara fil Islam, for the purpose of avoiding harms and minimizing injury to the patient. However, if upon weighing the effects of such a withdrawal, it is certain that it would result in a greater harm to the patients, then the artificial feeding should not be discontinued. So that's the end of my presentation today regarding on the withdrawal of artificial nutrition from the ethical perspective and from the Islamic perspective. thank you for your attention and your times, and for your listenings. I appreciate it and hope you enjoy. That's all from me. Thank you so much.